Hi, everybody. Thank you for watching Daytime. You've probably heard that heart disease is the leading cause of death in the United States. And now this, it's affecting even a younger demographic of people between the ages of 20 and 45. Today, Dr. Srinivas Iyengar, did I get your name right?
You got it, absolutely.
Okay, yes, sorry about that. Anyway, he's going to run through the cause of heart disease, the signs of heart attacks, and how we can keep ourselves healthy. Obviously, you're a cardiologist, and
absolutely.
thank you for being here.
Thank you for having me.
Let's first talk about some of the symptoms of a heart attack. Now, most of us know you feel pain in one of your arms and tightness in your chest, you're having a heart attack. But there's some other symptoms as well that kind of blew me away. Jaw pain?
Absolutely, and this is the interesting thing. When it comes down to having a heart attack, basically patients always seem to say, if my left arm doesn't hurt, if I don't feel an elephant on my chest, well, I'm not really having one then. Maybe it's something else.
Sure.
Oftentimes, though, we'll find patients that say, well, I thought it was heartburn, and after a bottle of Mylanta hasn't helped them basically take their pain away, they end up calling 911 and finding out that they did or are having a heart attack. So you can have symptoms such as jaw pain, back pain, left shoulder pain, chest pain, or in women and diabetics, oftentimes there'll be nausea, abdominal discomfort.
Cold sweats?
Cold sweats, absolutely. And the thing is that not all these symptoms obviously are heart attack. Many people have these things and not have an actual heart attack. But what we like to tell everyone at home is that when you have these symptoms and they don't go away after a couple of minutes, there's an old phrase that we use in medicine, and we basically say, time is muscle.
Time is muscle, so that means you're losing...
Exactly.
Yeah.
That if you are having a heart attack and you basically aren't getting that artery open up again, basically that muscle is not getting oxygen through the blood supply.
Okay.
And basically, the time is muscle. Basically, that muscle is dying. So
if you have these symptoms after a couple of minutes, then you should definitely call 911.
Absolutely. I do feel that there's no reason why a patient should say, well, or a person at home should say, well, I'll just suffer through this and see, maybe I'll see my doctor in the morning. Give the phone, pick it up, call 911.
Let's get into risk factors, specifically cholesterol. We know that's a big one for heart disease and heart attacks.
Absolutely, and cholesterol itself is something that we've been trying to hammer down in this country with a number of different modalities, medications, exercise, trying to really control the amount of cholesterol people eat in their diets.
What's a healthy level of cholesterol?
Well, a total cholesterol we'd like to see in most patients or most people less than 200. Basically, it'd be lower than that if you have heart disease or risk factors for heart disease.
Okay, gotcha. Now, what about blood pressure? Because blood pressure is a given. People know this.
Absolutely. 120/80 is what we consider normal pressure. And there's a level of 140/90, which is basically hypertension. So the area between 120 and 140 is considered pre-hypertension, which we like to then make risk factor modification and potentially medical therapy if patients have heart disease to get them to 120/80 or below.
Okay, all right, okay. And obviously diabetes is also another factor that you have to really pay attention to.
Absolutely.
Okay, so if you have any of these symptoms, can we prevent them? Can we reverse them? What do we do to keep our heart as healthy as possible?
Well, that's a great question, because the thing is, you can't change your genetics. You can't change your parents and what you've inherited. So that is something that you will have no matter what. But can we change the other modifiable factors? Absolutely. That's why they're modifiable, such as your diet, your exercise. If you have high blood sugar, obviously losing weight, trying to reduce the blood sugar, or going on medications. And obviously the cholesterol and blood pressure are the two big components as well. Now, the one thing I didn't mention, which is probably the most important of all of them, is not smoking. And clearly smoking has led to a number of cardiovascular deaths in this country. So clearly, if you smoke, stop. Okay,
stop smoking, and then cut back on salt. We're hearing that a lot these days. Why?
Well, that's a great point, because now in this day and age of fad diets, people always count their calories, they count the fat, they count the carbohydrates. But the thing is, people don't understand that salt, which is essential for life, but people need to have salt in their diet.
We need to have some salt in our diet.
Exactly, absolutely. The thing is that when people go to restaurants, a number of my patients will go eat out multiple times a week, and I've asked them, how much salt are you taking in at the restaurants? And they'll often say, well, I only eat a salad, but they don't realize they put cheese, croutons, dressing, which adds to salt.
And sodium levels, yeah.
And salt adds to blood pressure.
Well, listen, Dr. Iyengar, thank you so much for being here and keeping us healthy. We appreciate it.
Absolutely.
We hope to see you in the future. We'll be right back with more Daytime.